Hello, everyone. My name is Ishvia, and along with Navi, Joshua, Nicole, Kelly, and Sandra, we will be providing you with an overview of Sweden's healthcare system. Sweden has a decentralized healthcare system, both public and private healthcare. The country has universal healthcare for all legal citizens that provide comprehensive coverage for a variety of healthcare services. It is managed by local regions and authorities, and funding is through regional, municipal taxes and grants from the central government. Private insurance is also available as supplementary coverage to enhance access for specialty care, mainly sponsored by employers. Sweden's healthcare system has three basic principles: human dignity, need and solidarity, and cost effectiveness to maintain the health of its population. In 1946, the National Health Insurance Act was initiated in Sweden. Within a few years, universal coverage for all citizens started, with funding from the government through taxes. In 1970, doctors were being employed by the government, and the government started to have more control over the healthcare plan. In 1984, Sweden controlled the power to decide when and where doctors should work, and no control on healthcare costs. By 1990, healthcare providers could be owned by companies. From 2005 and onwards, Sweden has been aiming to provide quality of care for patients through its universal healthcare. Sweden is the largest Nordic country, with Stockholm being the capital. It's the fifth largest European country with over 10 million people. Sweden has 25 provinces, with a majority of people being Swedish, Middle Eastern, and Finnish. 75% of the workforce is between the ages of 15 to 64, with an average income per household being $33,730. Sweden has a stable political environment that allows its healthcare to be funded by the government. Economic costs are mostly within the pharmaceutical and medical devices industry. 11% of GDP in 2016 accounted for public healthcare in Sweden. There are a lot of sociological factors that impact healthcare within the nation as well, such as different cultural factors and socioeconomic status. Due to the high levels of literacy in Sweden, there is a lot of awareness around healthy lifestyle. There is also a lot of technological advancements in Sweden, especially around R&D, new products and development in healthcare, telehealth services, and AI. Legal regulations maintain patient confidentiality and safety rules, and there is a push for environmentally sustainable practices. Overall, areas of improvement include expanding telehealth services, improving geographical access for specialty care, and addressing healthcare inequities for patients with socioeconomic challenges. The top three primary healthcare issues in Sweden include cardiovascular diseases, various kinds of cancer, and mental disorders. Ischemic heart disease is the largest contributor to cardiovascular mortality, about 52 deaths per 100,000 people, followed by heart attacks, about 36 deaths per 100,000 people.
Hello, everyone. My name is Joshua Spear, and I will be discussing the governance structure of the Swedish healthcare system. Sweden's healthcare system has a decentralized governance structure. The responsibility of healthcare regulation, as well as the management, is shared between the national, regional, and local authorities. The national group is also known as the central government, regional, also known as the county councils, and local, also known as municipalities. The Swedish Ministry of Health and Social Affairs plays a critical role in creating national healthcare policies as well as regulations. However, the regional and local authorities have a lot of autonomy when organizing and providing healthcare. This approach creates a system that is flexible as well as adaptable to the needs of the population. Overall, Sweden's healthcare system balances central policy creation with decentralized healthcare service delivery, with an emphasis on accessibility, quality, as well as equity. Key entities and roles in the Swedish healthcare system. The local and regional agencies are managed according to the national as well as local priorities, as well as national regulations. Nationally, they are represented by the Swedish Association of Local Authorities and Regions. Also, the Ministry of Health and Social Affairs, which is responsible for setting national health policies, regulations, as well as guidelines. They play a critical role in creating and management of overall healthcare network. The National Board of Health and Welfare, they are responsible for providing guidance, monitoring healthcare quality, and they contribute to the creation of healthcare standards as well as policies. The Swedish Association of Local Authorities and Regions, they are responsible for representing the interests of county councils and municipalities. They essentially foster collaboration between the national government at different levels. In terms of county councils, there are 21 county councils. They are responsible for organizing and delivering healthcare services. Municipalities, there are 290 of them. They work in coordination with these county councils, and they play a crucial role in providing primary care or delivering primary care, preventative healthcare, as well as social services. Sweden's healthcare system coverage as well as policy framework. Sweden's healthcare system provides universal access to healthcare, which is accessible to all residents regardless of socioeconomic status. This healthcare system is publicly funded primarily through tax revenue or a very progressive tax code, which is responsible for facilitating the equitable distribution of healthcare services as well as goods. This healthcare system, like I mentioned prior to, is decentralized. The responsibility is shared between the national, regional, as well as local authorities and governments. In this system, there is embedded a type of patient autonomy. The majority of services that are deemed necessary are provided by the Swedish healthcare system, the government system. But in addition to that, patients have the opportunity to add coverage from a private insurer to supplement that public insurance. And the system also facilitates innovation. It incorporates technology in order to enhance patient care and efficiency. Market justice versus social justice in the Swedish healthcare system. Essentially, market justice means the distribution of goods and services determined by the free market and individual choice. This is altered or changed by the supply and demand effect. Healthcare is viewed as a privilege in the market justice system. So essentially, the private providers or the ability for patients to choose private insurers in addition to the publicly provided insurance is the essential market justice component of the Swedish healthcare system. The social justice component of the Swedish healthcare system essentially is the publicly provided healthcare. So social justice means the distribution of goods and services primarily determined by fairness, equity, availability of resources, as well as opportunity. This is beneficial to the society over the individual. Okay, universal access is a component of the social justice system, which ensures every individual is able to receive the care that they need based on resource allocation, so on and so forth. The focus on preventive care of this healthcare system ensures that individuals are seen and treated prior to their chronic illness or whatever illness they have becoming more expensive and weighing on the system, which also adds to the social justice component of it. And then also the tax code. The tax code ensures equitable distribution of healthcare resources as well as services.
Thank you, Joshua. To start out, coverage in Sweden is universal for all of their 10 million residents. The universal health care works so that a resident is automatically covered. 10% of that population chooses to have a private healthcare plan in order to have more options in terms of which specialists that they can see, and also to bypass any possible wait for those procedures. Of Sweden's $635.7 billion in GDP. 11% is spent on healthcare and funded by the use of public tax money. There's also around 3% of the costs that are going to be covered by patients by way of copay. Additionally, there are 21 regions in the country that are responsible for financing and delivering the healthcare services. For care of the elderly and disabled, or a patient needing long-term care, there are 290 local municipalities in charge. All right, and then here I have a chart that gives a breakdown of typical patient co-payments and safety nets. If a patient visits a doctor, they'll typically pay around 150 to 300 krona as a copay, or it's the equivalent of about 16 to 33 in US dollars, depending on what the currency is trading at. Specialists are also slightly more of a copay, with the average upper charge being around 400 krona. Now, if you need to go to a hospital, there's an out-of-pocket maximum charge of around 100 to 120 krona a day. Certain regions will charge an additional fee if you need medical transport by way of ambulance or a helicopter. Mental health and dental care are also covered here. And there's actually free dental care for children and youth under age 23. Now, moving right along here, emergency coverage is provided to all patients from the European Union with the use of bilateral agreements. Most of the regions in Sweden provide medical care free of charge for anyone who is under 20 years old. Out of all of these services covered, the most costly out-of-pocket expenses will come from dental and pharmaceutical benefits. You'll also pay a penalty for failing to have pre-certification for any services or procedures that you need to have done. And along with that, you can be denied coverage for any service that is deemed not medically necessary. So it's important to pay attention and just be aware of what's going on when you need care in Sweden. I'm now going to pass it off to Navi, who's going to be discussing health system performance.
Health system performance cost. Percent GDP increased to 10.8 in 2023 from 9.2 in 2022. Sweden spends about 6,438 per capita on health, more than the OECD average of 4,986. Sweden private consumption accounted for 41% of its nominal GDP in 2023. Sweden performs better than the OECD average on 94% of its indicators, such as quality of care, risk factors, access to care, and health system resources. Strategies to decrease costs in Sweden. Primary emphasis is on primary care and preventative care, and decrease risk selection in healthcare systems, focusing on financial risk adjustment. This method aims to align financial incentives with actual healthcare needs of patients, discouraging providers from selectively treating those deemed for more economically advantageous. Public health initiatives. Investing in public health initiatives to help to reduce the prevalence of certain diseases and conditions. In return, contribute to long-term savings. So who has access to healthcare? In Sweden, access to healthcare is generally available to all residents. The healthcare system is primarily funded through taxes. The Sweden's healthcare system follows the principle of equity and accessibility, aiming to ensure all of its residents. How available is primary care? Sweden is publicly funded, thus primary care services are readily funded through taxes. This publicly funded system contributes to primary care services are accessible to all citizens of Sweden. Primary care clinics are located in many areas and are easily accessible to residents. Many specialist access are available only through referrals from primary. Therefore, Sweden government ensures that primary care doctors are readily available. Primary issues relate to health disparities and equities. Healthcare disparities and equities in Sweden are contributed from poor socioeconomic factors. Individuals with low income and education for poor health outcomes. Individuals who are immigrants and are legal residents face barriers, including access to care. Citizens with mental health issues face healthcare disparities. Factors that can influence this include limited access to mental care facilities, socioeconomic status, and education competency. The Commission has undertaken various initiatives. These include organizing regional conferences, a large dialogue meeting with civil social organizations, expert hearings, and forming reference groups involving government office and parliamentary political parties. What is Sweden's safety net? It contributes to a combination of factors, including universal care, public care, emergency care, and preventative services.
Sweden makes healthcare affordable for all. As previously discussed, Sweden provides universal population coverage for a wide array of services. Health costs are mostly paid through taxes, as well as contributions from the government via general grants. A mere 3% of the cost is actually funded directly by patients, and though a copay is required for each doctor's visit, it is only between 100 and 300 krona, which equates to $9 to $29 per visit. The max a patient is allowed to spend in a year is 1,100 krona, which only equates to $105. Most out-of-pocket spending goes towards outpatient care and pharmaceuticals. Sweden's healthcare system works towards improving the quality of care. As we all know, healthcare is constantly changing. Thus, innovation is extremely important in healthcare. Sweden is one of the most innovative countries in the world and sets aside high expenses for research and development. Healthcare innovations can provide patients with better treatment options, thus improving quality of care and patient outcomes. Length of stay in the hospitals have decreased, and there has been a shift towards outpatient and primary care. This reflects a development in medical technology. Universal health coverage is provided to all residents of Sweden, while emergency coverage is provided to all patients from the EU or EA via bilateral agreements. Life expectancy in Sweden is one of the best, but social inequalities in healthcare remain a huge issue. However, good health and equal healthcare are the foundation of the Swedish Health and Medical Service Act. Inequalities can influence adult socioeconomic status, which can then contribute to poorer health outcomes. In order to prioritize reducing health inequalities, Sweden does the following: invest more in the early years. This includes providing maternity and child healthcare services, increases spending in schools to ensure that vulnerable children have the proper education, and ensures high quality employment by limiting 0 hours contracts. There has been a significant increase of hospital closures in rural areas, which has resulted in an increase of urban hospitals. Of Sweden's approximate 9 million inhabitants, 15% of the population was diagnosed with cardiovascular disease in 2012. In that same year, 38% of deaths were a result of cardiovascular disease, making it the most common reason for hospitalization. With all of the hospital closures, it was concluded that the probability of a patient surviving heart disease, such as acute myocardial infarction, would decrease by 2 percentage points. In 2010, Sweden went through a primary care reform, which dramatically increased the number of private providers. 3 years ago, approximately 750 of the overall 3,800 ambulatory care centers were owned by private equity funds. Benefits of private equity include efficiency as well as providing needed capital. Though the same regulations apply to both private and public-owned hospitals, there has been growing political disapproval to private equity involvement in healthcare. Late last year, the Federal Minister of Health announced that a law prohibiting private equity acquisitions of ambulatory care centers would be coming this year. As we discussed earlier, there has been a shift towards outpatient and primary care. The outpatient care market in Sweden is projected to grow by 5.16% between 2023 and 2028, resulting in a market volume of $10.43 billion in 2028. The increased use of telemedicine, such as remote diagnosis and online consultations, is expected to drive the growth of the outpatient care market. As expected, when it comes to utilization, its increase to high levels were associated with residents in urban areas, and decreasing utilization was associated with residents in non-urban areas.
Now we will look at areas of excellence in Sweden. The Swedish health system must cover all residents with universal healthcare coverage. 3 basic principles are dignity, need and solidarity, as well as cost effectiveness. Safety nets are in place for cost ceiling measures. Ceilings on out-of-pocket cost spending is applied to everyone. We see targeted groups, including children, adolescents, and elderly, exempt from charges. We also see with preventative services, things like maternity care, immunizations, and cancer screenings have 0 copays. We also see great quality of care as well as overall good health outcomes. Looking at challenges, there are 2 biggest challenges with the Swedish healthcare system, which are access to care as well as disparities. With access to care, we see long wait times for healthcare services. With public insurance, average wait times are anywhere from 1 week to 3 months. Some choose to buy private health insurance in Sweden. This allows for greater appointment times and opportunities with providers and different services. This also negatively impacted the COVID-19 pandemic negatively impacted waiting times. The Waiting List Billion was an initiative started stating that regions fulfilling healthcare needs are guaranteed to receive performance-based compensation. We also have seen the standardized care pathways, which help with regional disparities. This pathway stated and was put into practice to ensure that healthcare is provided and within certain timeframes for various cancer diagnoses. The Swedish Nation Audit Office has shown that the current initiatives to reduce wait times have been ineffective. We also see healthcare gaps between Swedish-born and foreign-born individuals. There has been little to no cultural adaptation and cultural beliefs, values, and languages with healthcare services. And poor socioeconomic conditions lead to overall worse illnesses. Here is a recent 2023 survey on what individuals thought the biggest challenges were facing healthcare in Sweden. So the highest contender was not enough staff. Second to that, we see access to treatment / long waiting times. Third, we see bureaucracy. And then going forward, we see aging populations, lack of investment, poor quality treatment, and cost of accessing treatment are just some of the major areas of challenges faced in Sweden. Looking at improvement opportunities, some that were suggested were updating the waiting list billion that I mentioned earlier. Also fostering equity and reducing wait times. So creating fair prioritization methods using standardized scoring systems with clear evidence-based criteria to reduce crowding out and incorrect risk prioritization in certain patient populations. Strengthening economic policy tools may help, as well as offering financial incentives to healthcare providers to hopefully increase the workforce. Looking at Swedish innovation, Sweden has a long heritage as a global exporter of scientific and therapeutic innovation. Oncology has been their largest focus in research recently. Sweden is unique in that researchers own the intellectual rights to their findings, which fosters innovative solutions to hopefully improve healthcare within Sweden. And the Swedish pharmaceutical pipeline stands strong amongst other European countries with actually less funding and investment. Looking at the drug development timeline, similar to the United States, there is different phases. We see drug discovery, which is where molecules and compounds are discovered. They then go into preclinical research. These two processes could take a very long time in Sweden, could take anywhere from 4 to 7 years. Looking at clinical development, this includes 3 different phases: phase 1, phase 2, phase 3. So in these phases, they look at dosing, how safe and effective it is, side effect profiles, and pharmacokinetics with different sorts of drugs. And then lastly, we see market approval, which is the registration process. This could also be known as phase 4. So this is post-marketing surveillance with different pharmacovigilance techniques to further test these products. So overall, we see a pretty long process with drug development in Sweden. That concludes our presentation, and we really look forward to your feedback. Thank you.